People who are at risk for HIV may have other behavioral health issues or social challenges that put them at risk for HIV. For example, they may be depressed, which is why they're not protecting themselves against HIV. They may be using substances that may impair their judgment. These are things that can affect people's pill-taking behavior, and PrEP, to be successful, means taking a pill every single day. In terms of improving PrEP delivery, the biggest challenge right now in the United States is training providers. There's something a colleague of mine calls the Perview Paradox, meaning this goes on. So infectious specialists are more used to taking care of people living with HIV, not high-risk individuals, so they don't necessarily feel comfortable doing all the counseling that goes into deciding who's appropriate candidate for PrEP. Generalists oftentimes feel uncomfortable. They're busy, they don't have a lot of time to talk about sex with their patients. Another challenge that they may have is they're not comfortable with the medications themselves. They're not used to prescribing antiretroviral medication. So in terms of improving delivery, education of providers and working through the barriers that they perceive to PrEP prescription, I think, is a big step. In terms of improving adherence for people once they get a PrEP prescription, the biggest challenges are to work with them to address the social and behavioral issues that might make it hard for them to take PrEP. If somebody's homeless, it may be harder to take a pill every day. So it's not considered part of medical care, but part of best practices is working with social workers or other services to ensure somebody has a stable living condition, which will help ensure that they're able to take the medication on a regular basis.